Good afternoon, everyone, and welcome again to the Institute for Global Health Sciences COVID-19 series. Today, we have one more exciting topic. We will be analyzing how different Bay Area counties have performed relative to the COVID-19 epidemic in our state. For that purpose, we have Dr. Arlie Mirzazadeh, who is an assistant professor of epidemiology and biostatistics, leading the conversation. And we have three wonderful young students, graduates, two of them, of our master's program, one who is a PhD student, analyzing the situation of different counties. Ali, you have the floor.
Thank you, Kemi, for the introduction. I'm very pleased to be in this talk today, and I'm going to share my screen and then introduce my team, amazing team, and then we will start there. Let me share. I think you see my first slide. So this is a presentation looking at the interventions and trends for COVID-19 in the place we're living in the Bay Area for all the 9 counties. And we looked at the intervention and trends for COVID and also modeled this trend over the next 9 months. And for this work, it has been started about 3 months. And we have been working on this on a weekly basis. I had pleasure to work with Chelsea Nash and Osamuedeme Odiase from master program, who just graduated last week from the Global Health. Big congratulations. And I was also was really pleasure work with Canice Christian from the PhD student in the Global Health. The idea behind this work was in the Bay Area, we have seen a number of cases going up again after a few months of declining or a kind of success. And now we have another waves of this epidemic coming to us. And we want to look at what happened, what was the level of the non-pharmaceutical interventions, how was the coverage and adherence from the population to those measures. And to see if we go with the current trend, what happened, or if we change the strategy to reopen, what's going to happen to the epidemic, and what are the pitfalls or something that would be lesson learned from the response to the COVID in the Bay Area that we can maybe look at and then rethink about those measures. For talk today, and Chelsea will going to present the current and past trend for COVID death and case and population in the Bay Area. Then Osamuedeme will talk about stage reopening and what are those stage reopening means in terms of numbers of adherence and coverage for those in the population. And then Canice will present the results from the modeling and the future scenarios effect. And I will come up with a wrap up on what went wrong and what we learned from the response. And I'm willing to answer the questions, and we will answer the questions at the end. So I will ask Chelsea to take it from here and then present the past and current trend for COVID in the Bay Area.
Hello, everyone. Once again, my name is Chelsea Nash, and I will be looking over the past and current trends of COVID-19 infections in the Bay Area. So as you can see, the Bay Area, California as a whole, makes up approximately 10% of the overall COVID-19 cases in the US and approximately 6% of the overall deaths. And if you look at the map to the right, you can see cases are primarily concentrated in the San Francisco Bay Area and Los Angeles County. Now zooming into the Bay Area, the Bay Area itself makes up approximately 10% of California cases. We have been seeing a large majority of cases in Alameda and Santa Clara County, and we have seen the least amount of cases in Sonoma and Napa. As you can see, all the counties are following a curve of it being skewed to the left. So that means that cases are in fact really increasing, except for Marin County, and it's been seeing a decrease in cases. The significant spike is attributed to the San Quentin COVID-19 outbreak. Now going into COVID-19 deaths. So similarly, Alameda County and Santa Clara comprise themselves of the most deaths, and all the other counties follow suit. As you can see, all the other counties have similar trends in terms of the death rates, except for Contra Costa. Contra Costa saw a marked significant increase in the mid-June timeframe as far as COVID-19 deaths, and it has been steadily increasing. Now I'm looking at the overall trends in cases and deaths. As you can see, the Bay Area and California are similar in terms of the trends of the outbreak. And the United States saw somewhat two peaks, one peak late April and another peak coming right now. But as you can see, California and the Bay Area, our cases are steadily increasing. Just a note, each graph is a different scale. In addition, the Bay Area and California are showing similar death rates overall. And while the death rates in the overall United States is kind of coming to a stable end, in the Bay Area and California, we have been seeing a noted increase. So as far as testing rates goes, we are doing amazing at meeting our goal of over 60,000 tests a day. So we're doing very well, and we have been seeing a marked increase overall in the number of tests that are being administered. But as far as positivity rates, on average, we have been below our goal of 8%. Hopefully we can get that a little bit lower. However, we have been seeing a little bit of an increase actually within the past 2 weeks. Next, I will be talking about COVID-19 hospitalization rates. So as you can see, COVID-19 hospitalization rates in the Bay Area and in California have been increasing significantly. We saw somewhat of a stable period between May 14th and June 11th in the Bay Area. However, it significantly started increasing at the end of June. We are seeing a similar trend in California overall. However, the Bay Area has saw somewhat more of a significant spike rather than California as a whole. So next I will be talking about non-pharmaceutical interventions. I will highlight a few. The first one is elderly cocooning. So elderly cocooning consists of the percentage of people of the elderly population who isolate themselves from the general population. The travel bans. For the international travel ban, we analyze the trends in overall international flights. And for household isolation, we were looking at the percentage of COVID positive people who isolated themselves in their respective homes. So this is a general timeline of the COVID-19 crisis in the Bay Area. So as you can see, first, bars were the first to close. Next, towards mid-March, schools closed, followed by a strict shelter in place was enacted around March 17th. And at the end of April, masks were enforced in the Bay Area. Mid-May, we saw low-risk businesses being open. Actually, towards the end of May, Napa was actually the first county to open their high-risk businesses. Mid to late June, we saw high-risk businesses being open in the other counties in the Bay Area. And the middle of July, the Governor Gavin Newsom ordered a scale back. So actually high-risk businesses then closed and we moved back to stage 2. Thank you.
Thank you, Chelsea, for brief introduction of the trend for what's going on with the cases and deaths in the Bay Area. So next, I will ask Osamuedeme to go and talking about what is the roadmap for recovery or reopening the California, which also applies to the Bay Area. And then we all heard about this 4 stages. Now we're going to go through one by one and then see how those stages actually reflected into the number of the people following onto those categories of like doing the non-physical interventions overall and in those subgroups. So please.
So I'll begin my talk by discussing California's roadmap to recovery. So stage 1 is characterized by safety preparedness. And so during this stage, there is an emphasis on building out testing, contact tracing, as well as hospital capacity, and also making workplaces safe for essential workers. Progression to stage 2, in which most of these counties are in right now, is the opening of lower risk workplaces, such as indoor and outdoor retail services, schools, and more public places. And the progression to stage 3 is characterized by the opening of higher risk workplaces with safety modifications, such as personal care services like hair salons and nail salons, entertainment venues. And finally, the progression to stage 4 is marked by a return to normal life and is defined by the opening of the highest risk workplaces like concerts and convention centers. So Napa, Solano, and Sonoma, we're at a head start as these counties progress the quickest into stage 2. As you can see from this graph here, Napa, Solano, and Sonoma began stage 2 in the beginning of May. However, Napa is an anomaly as this stage only spent about 2 weeks before progressing to stage 3. And as you look further down, you see that these counties spent time in stage 3 up until the middle of July, by which time they regressed back to stage 2, where it's projected that they'll spend 2 months before moving forward to stage 3, where it's projected that they'll stay here for around 3 months until mid-December, and finally progressing to stage 4 at the end of December. Contra Costa, Marin, San Mateo, and Santa Clara are in the middle of the pack because they progressed to stage 2 a bit more slowly. As you can see here, they progressed to stage 2 towards the end of May, briefly spent some time in stage 3 before regressing to stage 2, where it's projected that they'll stay here until mid-September before moving forward again to stage 3, where it's projected that they'll stay here until mid-December before proceeding to stage 4 at the end of December. And finally, there is Alameda and San Francisco counties. These two counties have progressed the slowest throughout the stages. As you can see in stage 2, these counties have not proceeded to stage 3 yet, and it's projected that they'll stay here in stage 2 until September, and they will proceed to stage 3 around the end of September as projected, and finally it's projected that they'll begin stage 4 at the end of December. So one of the important non-pharmaceutical interventions was the closing of schools. And so the coverage of school closure was calculated first by creating lists of institutions and schools, as well as information on student populations and dates of the school closures. And the coverage of the closure was calculated by dividing the number of students undergoing online learning over approximately the total number of students. And since data on private schools, pre-K schools, and some universities and colleges were not readily available, school closure coverage was set at 95% from mid-March to mid-September. And as regards stage 3, projected school closures during this stage was calculated first by looking up the reopening policies of post-secondary institutions. And so institutions were classified as either being online only, mostly online, in which 90% of students underwent online learning, or a hybrid in which 50% of students underwent online instruction or in-person instruction. There was a further assumption that 50% of K-12 schools would be closed in the fall. And again, to calculate the coverage of these school closures, the number of students undergoing online learning were divided by the total number of students. And finally, stage 4 is, again, this indication of a return to normal life. And as such, school closures was set at 5% during this stage. So taking a closer look into these counties, as you can see in the first graph, it's projected that 63% of schools will be closed for Sonoma County, in contrast to around 56% of schools being closed in Solano during stage 3. To direct your attention to the second graph here, as you can see, it's projected that 68% of schools is projected to be closed in Santa Clara County, as opposed to 55% of schools being closed during stage 3. And finally, we have Alameda and San Francisco, where San Francisco has relatively high school closure coverage, in which it's projected that 77% of schools in San Francisco County are projected to close in the fall term. So another important non-pharmaceutical intervention was working from home. And calculating these interventions were based on the stages. So for stages 1 and 2, the baseline work at home coverage was calculated with data from the American Community Survey of the United States Census. And so the baseline work at home coverage is basically what proportion of people worked at home prior to stage 1. In addition, the weekly work at home coverage for stages 1 and 2 was established with data from the Google Mobility reports. And so an example of this calculation can be seen here for San Francisco County for the week of 3/29, where the baseline coverage is 7%, which means 7% of people were working from home prior to stage 1. And the weekly increase from baseline was 70%. And this gives us a value of 77%. And so this means that 77% of people were working at home during the week of 3/29 in San Francisco County. Now, stages 3 and 4 were proxy measures, which means that these are projected work at home coverages for these stages. And in terms of how they were calculated, first, lists of business sectors for stages 3 and 4 were created for each of the counties. Then projected 2020 employment numbers were calculated using data from California's Employment Development Department. And so an example here is Santa Clara County during stage 3. So the estimated number of employees in stage 3 is around 77,000 people. And this is divided by the employed labor force to give a value of 7%. And so this means that 7% of the workforce work in stage 3. Then to calculate the projected stage 3 work at home coverage, 7% was then subtracted from the average stage 2 work at home coverage to give a value of 47%. And so this means that it's projected that 47% of people will be working from home during stage 3 in Santa Clara County. And so taking a closer look here, in the first graph, you see that around 50% of people in Sonoma and Napa counties worked from home during stage 1. And it's projected that around 29% of people across these 3 counties will work from home. And finally, a return to normal life, as indicated in stage 4, it's projected that around 24% of people will be working from home. And to the next graph, as you can see, there are 67% of people who worked from home during stage 1 in Santa Clara County, as opposed to 55% of people in Contra Costa working from home during stage 1. Furthermore, there's a drop in work at home coverage of about 20% between stages 1 and the projected stage 3. And finally, for Alameda and San Francisco, as you can see in this trend, San Francisco has a higher work at home coverage throughout the stages. In particular, during stage 1, 71% of people in San Francisco were working from home. And we project that around 50% of people will be working from home during stage 4. So social distancing coverage was calculated with 2 methods. The first was with the citizen science study. So there were close to 22,000 participants around the United States and a little over 10,000 participants in the Bay Area. A daily survey was collected from March 26th to June 1st, where participants self-reported how often they social distance. And so coverage was defined by, among all participants, what percentage of people had 0 interaction with other people outside of their household in the last 24 hours over the week for each county. The second method of calculating social distance coverage was with the use of University of Maryland's COVID-19 impact analysis platform. And so the data consisted of 6 mobility metrics that were combined to generate a social distancing index that ranged from 0 to 1, where higher scores meant that a larger number of people were practicing social distancing. And this data were used from the times of January 1st to March 25th and June 2nd to July 15th. In order to calculate the projected stage 3 numbers for each county, the mean difference between stages 1 and stage 2 across all counties were calculated, which ended up being around 8%. And this mean difference, 8%, was subtracted from the stage 2 numbers for each of the counties to give the projected stage 3 numbers. regarding the projected stage 4, the average social distancing index data collected from January 1st to March 6th, which represents normal life, were then applied to the stage 4 numbers for each of the counties. And so a closer look as to how people are social distancing on a county level, as you can see here in the first graph, around 46% of people were social distancing in Napa, Solano, and Sonoma during stage 2, but it's projected that around 24% of people will be social distancing during stage 4 across these 3 counties. As you can see in the second graph, during stage 1, 61% of people in Santa Clara were social distancing. In contrast, 55% of people in Contra Costa and Marin were social distancing during stage 1. In addition, there was about a 20% drop in social distancing coverage from stage 1 to the projected stage 3. And furthermore, it's projected that around 24% of people will be social distancing during stage 4. And lastly, there's Alameda and San Francisco. As you can see in stage 1, Alameda and San Francisco have about the same amount of people, or same proportion of people social distancing. But as you progress through the stages, San Francisco has a higher coverage of social distancing compared to Alameda. And so what the restaging plan looks like for the entire Bay Area, as you can see here in stage 1, 56% of people were practicing social distancing and 58% of people were working from home, as well as most of the schools being closed. Progression to stage 2 is marked by 48% of people now practicing social distancing and 49% of people working from home, with still majority of schools remaining closed. And majority of these counties briefly spent some time in stage 3 before regressing back to stage 2. And we project that all of these counties will begin in stage 3 in September, where 40% of people are projected to be practicing social distancing, 38% are projected to work at home during this time, and finally 66% of schools are projected to be closed. And finally, the return to normal life is projected to begin in December or January, where 24% of people are projected to be practicing social distancing, and 35% of people are projected to be working from home. And finally, only 5% of schools will be projected to be closed.
All right, thank you, Samara, for this presentation on the coverage and those numbers, which is, I imagine that they are much lower than what we expected as a social distancing and coverage of those things in stage 2, 3, 4, and so on. Now, I would like to welcome Canice to present the models and the results for the COVID in the Bay Area. So Canice, please take your floor.
Great, thank you so much. So today I'm going to be talking about modeling the impact of these non-pharmaceutical interventions on future trends of COVID-19 in the Bay Area, and specifically the 9 counties that make up the Bay Area. Next slide, please. Thank you. So the model that we use for our analysis was developed by the COMO Consortium, which is actually a collaboration between the University of Oxford and Cornell University. It's publicly available, so you can find it on the website at the bottom of the slide here. And what's really interesting about this model is that it takes into account the entire infection life cycle of an individual, from someone who's uninfected and non-immune, all the way through someone who requires to be treated in an ICU and requiring a ventilator. The model also takes into account around 50 other inputs and parameters. Next slide. Which in most cases, we tried to find county-specific variables, such as the number of cases and deaths in a specific county, the severity and mortality due to COVID in those specific counties, the population and the age structure of the counties, and other county area parameters, such as the number of available hospital beds, the number of available ventilators in the county. And then there's also some other variables that came from the published literature on COVID-19, such as virus parameters, so the incubation periods, hospital parameters, such as the percentage of people requiring ICU admission after being admitted to the hospital, the proportion of people requiring a ventilator, other interventions, which Osamuedeme presented on greatly in the last section, and Chelsea presented on the last section. And then lastly, social contacts data. So this is a really interesting component of the model, which takes into account the fact that the proportion of people who and the number of people who an average person will come into contact with at their school or at their workplace. And we actually took all of that data to better predict the impact of social distancing measures and mask wearing, et cetera. Next slide. Great, so I'm going to be presenting on 3 different models today. The first one I'm referring to as baseline, and essentially what the baseline is, we're referring to is 2 months in stage 2 and followed by 3 months in stage 3 for all of the Bay Area counties. And this is what we expect to happen based on what policymakers have told us so far, but obviously things are changing, but this is very rapidly, but this is what we expect to happen based on what we know at the moment. And so that's what we're going to be referring to as our baseline model for comparison for the rest of this presentation. The middle model, model 2, is a more conservative option. It basically is going to tell us what do we think would happen, what would the pandemic look like if we stayed in stage 2 for 4 months and then stayed in stage 3 for 5 months. And then the last model is, okay, what if we just threw up our hands and reopened straight to stage 4, middle of August across all the Bay Area counties? What would that look like? And it's important to note for this model 3 that we actually did take into account the fact that testing will still happen and the fact that people will still, especially those who are at high risk, will still probably choose to self-quarantine and maintain some form of social distancing. So while we do say stage 4 as a full reopen, we do realize that a certain portion of the population is still going to take precautionary measures. Next slide, please. So now to take a peek under the hood of what our model does. This is an example from the baseline model. And essentially what we're looking at here is on the y-axis, the daily cases. On the x-axis, we're looking at the timeline of January 1st, 2020 through the end of July 2020, so right around now. And the red line is the observed number of cases in San Francisco. So you can see there's a lot of noise, there's a lot of different peaks. That's to be expected due to the fact that testing occurs on certain days and people get results on certain days and it gets registered. So we expect to see this kind of noise here. But what's important is the light green line that goes through the observed number of cases. And that light green line is actually what our model predicts is going to happen, the number of cases that our model will predict per day. So you can see it actually fits the red line quite well. And then lastly, the dark green line up above, that's actually the predicted reported and unreported cases. So it's been well documented that the number of cases that we actually test and record in our systems are actually much lower than the number of cases that are actually circulating in the population. And that's due to testing, people not getting tested if they don't have symptoms or other barriers to testing and confirming those cases. And so that green line is the number of predicted reported and unreported cases based on our model inputs. So now if we zoom out, thank you, to the whole year, actually to an 18-month period, so a year from now. So we're looking at, now this graph is from January 1st, 2020, all the way through the end of June 2021. And what we see here is a zoomed out version of that previous graph with 90% confidence intervals on the predicted reported cases, which is the light green band, and then the predicted unreported and reported cases. So that's the dark green band at the top that goes off the top of the graph. Now that, the dark green line actually predicts, is the line that is predicting 48.5% of the San Francisco population being infected with COVID-19 over this 18-month period. And it's also important to note that there are about 1,322 deaths predicted during that time. And again, that's the cases are those that are both asymptomatic and also those symptomatic cases. Next slide. So that graph that we were just looking at is actually summarized a little more simply in the green graph to the left of this slide. So that's the staged reopening baseline, which is on the left. And as you can see, there's a twin peaks of the epidemic curve here predicted throughout the year. And you can see the first peak is around October, the second peak is around February. And those are actually in response to the reopening stages. So when we go from stage 2 to stage 3, some businesses reopen, a portion of schools reopen. And so that's when we expect to see the first bump. And then again, when we go from stage 3 to stage 4, we expect another bump. And compared to the more conservative scenario that I explained earlier, which is 4 months in stage 2, followed by 3 months in stage, 5 months in stage 3, excuse me, we expect 37% of the population to be infected. But it's important to note also that the curve is much lower. So you can see that while the peak is around the same time in October, the curve is much flatter. Moving on to the last graph here, all the way to the right, we're seeing what would happen if we reopen immediately to stage 4. And while the percent of the population looks similar to that of the baseline scenario, where it's 52% compared to 48%, what we're seeing is a much higher peak. And actually the scale on this last graph here is much higher than the first graph. So the peak here on October 7th is around just under 6,000 cases, compared to the baseline scenario where the peak is around 2,000 cases. And again, those are the reported and unreported cases, so that includes those asymptomatic cases that aren't being tested. And so now we repeated this process for the next 8 counties. And for the purposes of time, I'm just going to be talking about the baseline scenario here, the green graph all the way to the left. But I'm happy to share these slides with anyone who's interested. Feel free to reach out. So for Napa, what we're predicting is actually we just passed the peak on July 29th, and with a predicted population percentage being infected over the period, the evaluation period of 46.5%. Next slide. Marin County, we're expecting a peak right around now as well, with 45.1% of the population being infected over the 18-month simulation period. Next slide. Alameda County, similarly, we're seeing a peak around the middle of July. So coming off of that peak at the moment with around 40% of the population of Alameda being infected. Next slide. Solano County, around 30% of the population with actually 2 peaks, the second peak predicted to be around April. Next slide. Contra Costa County, we're anticipating around 35.6% of the population being infected with a peak again in mid-July. Sonoma County, we're anticipating 42.5% of the population being infected with a peak in October. And then San Mateo County, this curve looks a little different, with 41.2% of the population being infected, and a peak actually on March 10th. And Santa Clara County, again, you see the 2 classic peaks here with a 2-stage reopening, with the second peak on the beginning of March, and 37.5% of the population being infected over the follow-up period. So now to kind of summarize all of these results into a single graph, what we're looking at here is attack rate per month. So that's the percent of the population being infected in each of these counties per month. And so this is based on the baseline scenario, so 2 months in stage 2, followed by 3 months in stage 3. And what you can see is that the curves of the epidemic actually are different for each of the counties, which is to be expected, with Napa County actually having the highest peak this month predicted at about 9% during the month of August. And again, this is predicted reported and unreported cases, so it includes those asymptomatic cases that are circulating undetected. And then San Francisco County, you can see is this blue line here, and it's actually peaking around February 2021. And that's actually likely due to schools predicted to be reopening during in the new year at the beginning of 2021. And that peak is around 7%. Next slide. And so now to kind of sum up all of the data that we collected through these 3 simulations for all 9 of the counties. And what we project is that based on the baseline scenario, which is 2 months in stage 2, followed by 3 months in stage 3 in all the counties, we anticipate around 3 million projected cases, and those between January 1st, 2020 through the end of June 2021. And those 3 million cases include the reported and unreported cases, and we project around 7,000 deaths. Compared to the more conservative scenario where we spend an additional 2 months in each reopening stage, 4 months in stage 2 followed by 5 months in stage 3, what we're seeing is 700,000 fewer cases and 2,000 fewer deaths compared to baseline in that scenario. And then lastly, compared to reopening now, we're seeing 300,000, or now as in middle of August, we anticipate 300,000 more cases and around 1,200 more deaths compared to baseline. And with that, I'll actually send it over to Ali, who will talk about what went wrong in the Bay Area in California and give us a little light at the end of the tunnel. Thank you.
Thank you, Canice, for presenting the results. Now, I'm going to share some thoughts about what's going on and what happened, which may have some clues about looking at those screens and the future that's happening for COVID in the Bay Area. So the first thing that I should say, actually, when the orders of the COVID-19, like shelter in place and all those things lift, actually Americans move a lot. So we have seen people go back to work, do parties for 4th of July and Juneteenth, move for recreation, go to shopping and those kind of things when they're open, and then summer vacation and backyard parties. And we have seen outbreaks reported for those causes around the country, including the Bay Area. If you really want to look at some numbers, which is the CDC trackers give you an idea, like when we're looking at the workplace at this moment, which is August, beginning of August, like minus 44% of the people to go to work actually, they are staying at home, in compared to the baseline, which was on February 2020. Going to shops and recreations and shopping is now less than minus 38% from baseline, but it's actually more happening than the time when we had a shelter in place or here in this area. Using transit stations and public transportation is minus 55 at this moment, which is a little bit higher than the place we had back in April and May. Staying at home right now, the measure is about 38%, which was much higher back in 2 months ago in April and May. And right now, it's expected, or this measure is telling us, like on average, each person is actually moving about 6 miles per day, which is a lot of movement, and that lead to kind of increasing the risk of transmission for COVID in the Bay Area. And this is specifically talking about all those things that happen in the Bay Area. So clearly, moving around, going to work, just going for shopping, not staying at home, that's really clearly the trend is really corresponding to increase in the number of the cases. But let's look at what we're going to do as a response for the counties. So here is a table that the California Department of Public Health actually watch the counties on how they're performing on testing per day, and then how the number of the cases rise in last 2 weeks. What is the positive rate for the tests? And what is the increase in the hospitalization need and ICU and ventilation? As you can see in this table, all of those counties actually doing great on the testing per day, and they're really far beyond the threshold that they put them at the risk of going out of the hospitalization and need for ICU and ventilation. The only one criteria that they all couldn't meet, except for Sonoma, was number of the cases that rise in the last 2 weeks. And the threshold actually is they should be all, each of those counties should be less than 100 per cases per 100,000 in the last 2 weeks. Alameda, for example, San Francisco and Santa Clara, actually, they are at the border. So a little bit more precaution about those risk measures, and having the population just follow those things. They may meet this criteria and go back again to the schedule for reopening, but not the others. For example, Marine is far behind those measures and thresholds. And these are like likely, this is also another table looking at what happened and what is the status of those counties. And as you can see, in most of the county in Bay Area, going back to work and opening the county business, opening the viner or farmers, going to agriculture work, those kind of things actually contributing to have them, the counties, to pause on reopening. In addition to hospitalization increase that happened in Santa Clara, Contra Costa, and the rest of the counties, like you can see those things. And socializing, it's the major things that reported for the transmission category for most of the counties, which should be relooked at again if we want to go back to the normal reopening plan. The issue of the COVID is now different from 2 months ago. Now we have more cases of transmission that happened because of the asymptomatic transmission. And the studies show that this is terrifying. The COVID can be transmitted from all of those things: contacts, droplets, airborne, vomits, fecal oral, and then bloodborne and mother to child. So this is really a virus that take opportunity to transmit through any kind of way that you think of as respiratory infection and virus. But if you look at the numbers, 44% of transmissions may have happened before even symptoms appear. And then another 60% population actually never have a symptoms and they transmit. So clearly, asymptomatic transmission is a really contributor for rising the cases in the Bay Area. We had a lockdown and it happened in March 16. And there was a lot of discussion about it was late or too late. Yes, look at these numbers. At the time the shelter in place was ordered for the Bay Area, it was about 300 cases reported in the Bay Area at the time. When you look at the model of the Bay Area, our model, we found like more than 3,000 cases already have been infection before March at that time. So it looks like even the lockdown has measured, lockdown intervention started before any other places in the US, but it was already late for the Bay Area. And that is contribution to continuous transmission in the future months. There is an issue with travel and imported seeds that coming from other places in the US and internationally to the Bay Area. Right now, 56% of the transmissions in the Bay Area actually in the San Francisco County. There are assigning to community contacts and no case linked to those things. I couldn't find the data for really looking at the like imported cases of COVID travel cases to the Bay Area, but it's likely. So I think this is something that we should look more into the data to find what proportion of the imported cases in the Bay Area contributes to rising in the case in the epidemic here. There's an issue about, is it because we more test and we find more cases? Not actually. So it looks like the testing capacity or the testing is capping at San Francisco, and also it's somehow increasing on Contra Costa, decreasing in Contra Costa. At the same time, look at Contra Costa, the number of the cases that become positive out of the daily test is actually increasing, and it's more than 10%, which is more than the goal or the threshold of 8%. So yes, we find more cases, but not because we test more, but actually the positivity is higher and the transmission is going on within the community. Are we doing better and testing and tracking people over time? And this is the data from San Mateo cases. And as you can see, in the last 2 months, the percent of the cases that reached by the investigator for contact tracing actually dropped. Now it is like 34%. Some of that things 34 is because of the lag between reporting to the system and getting into the data, but it's clearly a problem, like finding and reaching to those cases that came positive and then reaching to those contacts is not that much improving over time, and that is a challenge for the system to be responsive and then mitigate the transmission from the identified cases. Here is a slide I put together for looking at if the protests in the June for Black Lives and all of those things that happened in the Bay Area could contribute to a rise in July for the COVID in the Bay Area. Looking at those measures, like most of them were outdoors. They actually used pretty much masks. They were young. 6% of overall population contributed or attended in those protests, and pushing people, those protests actually pushing people to stay more at home, especially with the curfew effect. And looking at this paper, it looks at 1 day or 2 days or 3 days after the protests that happened in all those counties in the United States, you can see the effect. Actually, it helps or it moves people to stay more at home. So it's unlikely that going out for the protests in the last month contributed to rising this month on the cases. But here's an interesting paper from European countries. It's a simulation model, and it's talking about how is it important to have a coordinated response and synchronized response when we're going to do a lockdown or something like that, or shelter in place. Let me explain part of this graph. This is a simulation. So in 3 months after, when all countries in the Europe started a synchronized lockdown with 2 cycles each 4 weeks, the number of the cases actually dropped for 100,000 cases. But if 50% of the countries in the Europe actually do the same thing, but it was asynchronized, there was less much effect than that. So what is it telling us? Even if the United States are doing what, based on decision or kind of public response is on their hands, a synchronized response across the states, a synchronized response across the county and the government in the United States is really much important than having a lockdown that is somebody start here, somebody starts like next month. So this is clearly, we need a synchronized response across the United States to get this COVID under control. And here's the response. Looking at a very nice measure, complex measure for government response for COVID. And the scale is 0 to 100%, 200. And 100 means the government has done whatever is possible. Like they close the lockdown, they do the testing, they do the contact tracing, they close the schools and works. And as you can see, I put 3 countries here, Germany, Italy, and United States. Even if at the first peak of the epidemic, the response for the United States doesn't go up to even to 80% out of 100. But the response for Italy, the response for Germany, which was happening in 2 times, it was more aggressive, it was more rapid, and it was relevant to the COVID. So it's clearly US could have done better on the response, but behind. And there are other things that I can say about why we see a rise is outbreaks that happen in prisons and long-term care facility. And looking at the prisons in, for example, in the Marine San Quentin, they have more than 2,000 cases reported. It's a huge burden for the system to cover that. There's also an increasing number of the cases that happen in long-term facilities. Now, 47% of Californians who died actually coming from those facilities and long-term facility. It's clearly a rise in April, and it was an outbreak in July and still going. So responding to those prisons and long-term facility and having a better infection control at those things are really, really important for Bay Area. Do we need to start again? Well, yes, we need to start again looking at simple behaviors, hand washing, mask wearing, and social distancing, and plus awareness of the population. So if people really know about what is the symptoms, if they actually believe that they got infected is going to be serious, they're going to respond well. So it's how you message this to the population and how you enforce those simple behaviors to be run by the population, looking at those coverage for social distancing. It's not great. It's not going to be great also when we are going to reopen. So rethinking about how we can encourage people to obey or follow those interventions is really a key important to respond. And my last question is about what should we do at reopening the schools? So opening the schools is really a hot topic. And here is an example from Israel. When they opened the schools last month, and it was a high school, in 10 days when they opened, 30% of the students become infected, 16% of the teachers become infected. So it's serious. They had a screening system, they had all those measures that they thought they would be effective, but it was like a disaster when they opened. And I'm really encouraging you to look at this New York Times paper. It's predicted like if you go opening the schools by 5,000 or 500 students, you will expect 2 to 4 cases of students to come with you with infection in the first week in most of the Bay Area counties. If you go with the smaller schools opening, the risk is much higher, much lower. If you go with a pod of students not linked to the other students, the risk is almost 1 or 0 for the first week to be infecting the students. So thinking about school closure and is looking at what is the background infection in your area, and also what is the size of school you want to open. And this is maybe one thing I want to mention, like having all those reopening stages is just related to having a good ideal screening plan. And reopening should go with testing everybody who goes to school back to campus or the work. And then the second, having a good or retest the people, also looking at the symptoms and asymptomatic cases. And if the people or part of the population do not follow the guidelines or measures, they should be at the sentinel surveillance testing for those in 2 weeks. And then follow this testing and linking to reopening will help the Bay Area to move on with the reopening plan. And I will stop here. And I think the message here, and when looking at the measures, we're looking at the coverage, it's not over. We all need to rethink about this. We need to play our roles to control these things, and it starts from us, individual and also responsible government. So I hope this will kind of refreshing us that we need to take more careful about our party and our individual and the community to control this epidemic.
Okay, thank you, Ali, very much. We're running out of time, but we do have 7 minutes to go through Q&A. Our Director of Communications, Kemi Amin, will kindly take us with the Q&A. Please, Kemi.
Sure. Good afternoon, everyone. We have about 7 minutes, so we'll get straight to the audience questions. So the first one, I believe, is for Canice. For the model, is it referring to 50% of the population of San Francisco getting COVID or 50% of the Bay Area?
Those first few graphs were county specific. So we were looking at around 48.5% of the San Francisco population projected to be infected by the end of the year. By the end of a year from now, the end of June 2021.
Got it. Great, thank you. So the second question we have is about the data. When reporting on positive test cases, are they unique positive tests, meaning someone who hadn't previously tested positive who is testing again to see if they still have it? Or do the stats reflect positive cases for those who previously tested positive?
I can try. I don't know if they exclude repeated cases.
Okay. Next question. Any benefit for going back to stage 2 for a few months to further prevent the second peak?
I'm happy to take that one. Yeah, so that was one of the things that we were excited to model, is looking at what would happen if we went back to stage 2 and stayed in stage 2 for 2 months, which is what is happening now. And we really do see a peak following each of the reopening stages. So, even though no one wants to hear we want to regress back to stage 2 from stage 3, which is happening across the Bay Area, we are seeing that the case numbers are projected to go back down. It's just less risky.
Got it. Next question. I'm not sure if it's helpful to treat schools, quotes, as uniform entity. How about thinking about subpopulations such as bringing back the youngest students and or those who are academically at risk? And then they state, in your example, you mentioned only one high school, i.e. older children, in which we know that they relax masking requirements because of heat.
Yeah, I think that's a question for me. I think at any point, the idea about reopening should take into account how many students you were going to put to school. So if you think you're going, you should be better than less than 100 students at the school at any time. And then you should also think about what is the size of the classes. So a size of class with 30 is too much for, so for any kind of social distancing or following or watching or the interaction between students and teacher. So, but if you go with the size of 10 or a pod or a class, something like you, is going to be more safe. So right now we are going to get more kind of simulation studies and then studies looking at this one. And the priority going with the younger age, those who actually not benefiting from online, it depends on the, like, which population you can reach and then how you can serve them. In terms of reopening, I think it should be goes by area and then what size they can cover in school.
Thank you. Next question, I believe, is for Chelsea. What is the explanation for the huge changes in deaths reported from day to day in the Bay Area?
So as we know, we saw a significant increase in overall cases within the last 4 to 6 weeks. And so death is just lagging behind the cases. So we believe that that's kind of why we've been seeing a notable increase in death.
Next question is for Canice again. Why do the curves look so different except for reopening immediately among various counties?
Great. Yeah, so that because we took so many different factors into the models and all the different populations are different across the different counties. You know, it has to do with the number of schools and the number of people in the schools. It has to do with the number of infections that we're already seeing circulating in these populations. And also it has to do with the impact of these parameters on the different stage reopening. So each reopening stage, you know, stage 2, stage 3 means something different to each of the different counties. And we took that into account in our models. And so that's why, you know, for some counties, San Francisco, you can see the 2 classic bumps after following both stage 2 and stage 3. But that's not the case for all the other counties. Some of the other counties, the difference between stage 2 and stage 3 is not as distinct.
Thank you. And this is a final comment for, I believe, Osamuedeme's presentation. They mentioned shockingly low social distancing, even in stage 1. I don't know if you want to speak to that.
So for how social distancing was measured, specifically, they're looking at different metrics. So what percentage of people are staying at home, you know, how often are people going, you know, to like the stores or to transit places. So there's multiple metrics that are combined to create that social distancing index. So it's not a pure, oh, I'm just staying at home for some duration of time. There are multiple factors into it, and so that is what contributes to that best value social distancing coverage.
Thank you. I believe that's all the time we have for today with questions, so I'll hand it over to Jaime.
Thank you, Kemi, and thank you, Ali, and everyone here for a really superb presentation. Next August the 18th, the topic will be innovations in diagnostic technologies. And we're fortunate to have one of the top world expert, Dr. Michael Bush, who is a professor at UCSF and also director of the Pacific Blood Centers, talking about diagnostic tests. So thank you again and look forward to see you on August 18th. Thank you and goodbye.